Hi, I'm Mina Malik Hussain and this is The Coffee Table, and today we have a doctory show, my favorite kind, and today we're going to be talking about hepatitis. And I'm sort of smiling right now, but it's actually a very serious situation. According to the WHO, viral hepatitis is the 8th highest cause of death globally. And in the Eastern Mediterranean region, Pakistan and Egypt seem to have terribly high rates of hepatitis in the countries, with Pakistan having about 12 million people with hepatitis B or C, with 150,000 new cases annually. So what's going on? What do we need to know about hepatitis? What are the implications? What are the morbidities? And what are the mortalities for hep? And why are we still getting it? And what's going on here? So to answer all of these questions and more, we have two excellent doctors on the show today with us who are going to sort of, dive into the heps with us. I'm very happy to be welcoming on the show Dr. Nadeem Iqbal, who is a consultant gastroenterologist at Shifa International Hospital. We're also joined by Dr. Shahzad Riyaz, who is a consultant gastroenterologist and hepatologist, and also an interventional endoscopist. Many talents. He has over 15 years of experience working in the United Kingdom, where he trained at the liver transplant unit at the St. James University Hospital in Leeds and the hepatology unit at the Royal Hallamshire Hospital in Sheffield. Welcome to the show, doctors. So, Dr. Nadeem, let's sort of begin at the beginning. And this WHO statistic is about viral hepatitis. So, are all hepatitis viral, or are there other ways that you can get hepatitis?
Well, when we're talking about the hepatitis, so it is spread mostly by the viruses, and we divide them into like hepatitis A, B, C, D, and E. But not all the hepatitis is from the virus, because our liver hepatitis by its mean that the inflammation of the liver,
right?
And it is not exclusively virus, so it could be from the other causes. Like we can get autoimmune hepatitis, which is when our own immune system is attacking the liver. We can also get hepatitis from the medication, from the drugs, from the herbal stuff. And there could be other causes of the hepatitis. For example, somebody can get hepatitis from iron overload, which is quite common in the West. We call it hemochromatosis. And sometimes we can even get by hereditary, the causes of the hepatitis, like Wilson disease, which we have, the improper metabolism of the copper. So yes, so the viral hepatitis is not only the cause of hepatitis. We can get hepatitis from so many other reasons. Right. But unfortunately, by far, this is the most common way of affecting the liver is the hepatitis. Because I think, as you alluded in your speech and start, that it is a global problem. Unfortunately, it's a global problem. Yeah.
So, from what I understand, hepatitis is also sort of roughly, if we were to kind of divide the various kinds, there's waterborne hepatitis and then there's blood-borne hepatitis. So, what's happening in the water that makes the liver sick?
So, because we're specifically talking today about the viral hepatitis, so we divide them, as you said, to the two kinds basically. One is which are transmitted by fecal-oral route, that by eating contaminated food, and that is the hepatitis A and hepatitis E.
Yes.
So both are spread by this fecal-oral route. And the other viruses like hepatitis C, B, and of course hepatitis D or Delta virus, they are spread by the blood contamination directly. So in case of hepatitis A and the hepatitis E, so we get them if somebody can get it if they eat any contaminated food, which could be even simply water. And most of the time, it is the contaminated water which transmits the disease.
So you were saying fecal-oral, which means that their sewage in the water can lead to hepatitis A and hepatitis E in a person. We did a show on typhoid as well, and it's shocking how many things float around in the water with typhoid and polio, and now hepatitis as well. So if we sort of now steer our sort of course, as it were, to hepatitis A, Dr. Shahzad, I know that 50 to 60% of viral hepatitis in children is hepatitis A. So how does hepatitis A manifest or present itself once one is infected?
Okay, so as you rightly said, that the hepatitis A is spread through contamination of food material and water. And that's why it seems to be more common in the children, because as you can imagine, they can pick up stuff from the floor, eat and drink on their own accord. Their hygiene is not as good. So the spread of that type of infection is much more in children. Now, the problem with all of these viruses is that they have an incubation period. It's similar, if I take an analogy to coronavirus or COVID virus, a person can become infected by this virus or any virus without producing any symptoms for a good few weeks. And during that time, they are shedding off the virus in their stools, and they can, spread the virus to other people. So if, for example, if somebody has eaten, let's say, a burger in a shop which didn't have good hygiene quality or, has hepatitis A in them, their liver will get infected with that virus. Their body will then start reproducing that virus and excrete it in their feces. And if they don't take good hygiene, it will spread to other people even before they develop any symptoms. Coming to the
so that means that if you're not washing your hands, so if you're not washing your hands properly, and then also if the water is contaminated with feces that is actively shedding the virus, then there you go. Wow. Yes,
so
please.
We call this fecal route, but it's not actually. If you try to picture that the feces, the sewage water is mingling with the drinking water, that usually doesn't happen. It's just a small amount of contamination. If somebody, for example, has used the toilet and has not washed their hands, nicely, and have touched for example, the dinner table, somebody else has come and touched the dinner table and eaten something, that can even spread the virus. It needs only a very few number of viruses to enter the body through the mouth to cause the infection. Coming back to the symptoms that you were saying, with regards to hepatitis A, it can have an incubation period for up to 30 days, which means that the person can have the virus without producing any symptoms for that amount of period. Now, once the symptoms develop, there could be a wide variety of symptoms. Another thing I want to mention here is actually it's the reaction of the body to the virus that produces the symptoms and not the virus itself. And that's why people who have a very good, strong immune system sometimes produce a very sort of aggressive sort of reaction and produce more symptoms. The symptoms could be anything from being very asymptomatic, as in having absolutely no symptoms. So people can have the infection, it can enter their body, reproduce, spread other people, and they can have absolutely no symptoms. To increasingly, people may have temperatures, fever, they can become icteric, which means they can become jaundiced. They will have malaise, muscle aches, general symptoms of viral infections like flu-like symptoms. And that can then, increase to people who develop deep jaundice. Their skin color becomes, deeply yellow. And that can then lead to dangerous conditions in a very small number of people. However, these conditions can be really serious, and some of these serious symptoms are developing of confusion, because the brain starts to become swollen, or they can develop bruises on their body because their blood doesn't clot very well. So any of those symptoms, if somebody develops with hepatitis A, are life-threatening, and those people need to see the doctor really soon. But but fortunately, those sort of symptoms happen very few and far between, less than 1%.
Lead me to my next question, Dr. Nadeem, that hepatitis A, and like Dr. Shahzad said, a lot of times people don't display any symptoms, so they don't even know they're sick. But hepatitis A, which we sort of commonly refer to as jaundice, which is actually just a symptom, not the disease. So if you say, I got jaundice, that's just a symptom. A little medical nerdiness here. But hepatitis A is often called the silent killer also, because is it possible to just sort of have hepatitis A, not even know you have it, but then suddenly get really ill as well? What happens if that happens?
So, as very nicely alluded by Dr. Riyaz, as we said, that the majority of the patient will not have any symptoms, or they have a very, very mild disease. Now, the problem here is that as we said, the incubation period can be up to 4 to 6 weeks sometimes, and the patient can be shedding the virus in the stool, and they themselves have no symptoms. Most of the time, I can just briefly, before touching this, I can tell you one thing, and you would understand that how common is this disease in the children. This was one of the study, I think, and it was published here in Pakistan, that they actually have tested the children between the age of 1 to 5, and they have actually noticed that up to 80 to 82% of the children were affected, and most of them did not have any symptom. And most of them did not have any symptom, or they were not aware of the disease. So it is so common. So it's very, very unfortunately, this is something which is preventable. And
but Dr. Nadeem, what if you have it, and like so many kids have it, and I'm sure so many adults also have it. So if you have it, you don't even know you have it, and then you recover. Can you recover completely from Hep A? And does that mean that you then have sort of universal immunity to it subsequently?
That's true. That's very much true. So as we said, most of the patient will not have any symptom, because this will usually brought into the notice because of some other illness. For example, if some patient have a fever and they come to the doctor and we do the test and we found that their liver is affected because their liver function tests are deranged. That's how the doctor will do the other test and would know it. But if the patient has no symptom, he will not go to seek any advice.
Yes, quite right.
He will not be diagnosed. He will not be diagnosed and will be left undiagnosed, and he can pass on disease to the other. But most of the time, hepatitis A is, by and large, our body controls it ourselves itself, and it will resolve spontaneously most of the time. Most of the time.
So most of the time, it's not something that will cause liver damage or kill anybody in most cases. But the main problem with undiagnosed Hep A is that you will be shedding the virus and you keep infecting other people. Is that correct?
That's absolutely right. Yes. So we can keep shedding the virus, transmitting the disease to the healthy individual. But again, as we said, 99.5% of the patient, they do recover very well, and we do develop immunity, which means that there are very less likely chances that they will develop it again.
Well,
the chances of having a chronic liver, but the chances of having chronic liver disease from hepatitis A are negligible. But there are conditions. But there are conditions in which the patient do get what we call a relapsing hepatitis A, that they may get disease. Usually it is lasting for a few weeks, like 4 to 6 weeks, but some cases it can last longer. And in some cases, some patients do also get what we call relapsing episode, that they do get
you keep sort of getting reinfected. Well, cool. That's Hep A for you. We're going to take a very quick break at this juncture, and we'll be back in a flash with all the other hepatitises. Stay with us. Welcome back to the coffee table, where we're having a conversation about all the different kinds, 5 different kinds of hepatitis that people are infected with on a very regular basis all over the world. All over the world, we're still battling with hepatitis and trying to figure out where to stop it, how to prevent it, what's going on here. And we are in conversation with Dr. Nadeem Iqbal, who is a consultant gastroenterologist at the Shifa International Hospital in Islamabad, and Dr. Shahzad Riyaz, who is also a consultant gastroenterologist, hepatologist, interventional endoscopist. All these medical shows are real tongue twisters for me. So before the break, Dr. Shahzad, we were talking about Hep A and how, by and large, many people have it. They don't even know they have it. They recover from it, and then they're also then immune to being reinfected by it in most cases, which seems to me a sort of strangely sort of happy, benign neglect situation. And then you sort of just carry on eating all your dirty foods from the bazaar, and you're all right. But then the other kind of waterborne hepatitis, which is hepatitis E, Could you tell me a little bit about that? Because I know that that is something that's quite serious for pregnant women. And it's also an hepatitis that we don't know much about. At least it's not a very common one.
So hepatitis E is E for egg, is a relatively newer virus.
Okay.
It was sort of cloned first in the 1990s, late 1980s and 1990s. There's actually an interesting story for it because the person who discovered it actually filtered his own feces and drank a bit of it to see if he can get infected with it. But that's the level
dedication to science.
Well, but that's the level of dedication that some of the doctors, had to discover these viruses. Now, hepatitis E for egg is very similar to hepatitis A.
Right.
With two main differences. One is the geographical distribution of this virus. So in which areas does this virus affect? And it does affect in our area, so in the subcontinent. So India and Pakistan are sort of the main hubs for this particular virus.
Right.
And the second difference, which you alluded to, is the increased mortality or seriousness of this disease in pregnant women. So coming to the first aspect of this virus, it is actually more common than hepatitis A in our country, and it's increasing worldwide.
Yeah.
And most of the epidemics in which you see large populations being affected by hepatitis are actually because of hepatitis E. So it is, although people know hepatitis A more, but actually hepatitis E is increasing and is probably more prevalent than hepatitis A nowadays. There are various tests that can be used to diagnose it, but unfortunately some of those tests are expensive, are probably not available in the smaller cities, and even if you send the test, it takes a good few days for them to come back, and during that period the patient continues to remain infective.
So does hepatitis E present in similar ways as hepatitis A?
It's very, very similar in its presentation to hepatitis A. When we are teaching students, we teach A and E together because their symptoms, their sort of the way they present, the reason why they happen, the prevention, the treatments are very similar in both of these viruses. Now, the second point, the important point, was that in pregnant women. So what studies found out that hepatitis E can be fatal in up to 3 to 4% people in the normal population, but that can go up in the second and third trimester. So later on in pregnant women, it can cause more serious issues. So that is something that is very worrying.
Vaccine for Hep E? Because I know there is one for A, but if one is pregnant or about to get pregnant, is there a way that pregnant women can ensure that they don't catch it?
That's a very good question. So hepatitis A has had a vaccine for a while, and that is given and is effective for 5 to 10 years, and people can have booster doses as well. With regards to hepatitis E, recently, a vaccine has been introduced or is in the process of being introduced in Pakistan. That virus has been, that sort of vaccine has been out there for several years. It was developed in China. Unfortunately, it hadn't been picked up by the world as such. And there were several reasons for that. One of the reasons was that most of the studies that were done in China and not in the Western countries. But there's a reason for that. The Western countries do not have hepatitis E that common, so they didn't do those studies.
Is that because their water is generally cleaner?
Yes, as I said, that there's a geographical distribution for these particular viruses. And we in Pakistan and the subcontinent, unfortunately, we fall into the belt where hepatitis E is a major issue and can spread very quickly. So that's why the government has worked with various stakeholders and pharmaceutical company in Pakistan as well. And we have started to bring this vaccine to Pakistan.
That's great.
The idea is that the idea is that we can give this vaccine to patients or who are at risk, people who live in high-risk areas, in epidemics, but the exact way of distributing this vaccine is still, and the details are still being sorted out.
No, but excellent. That's extremely important to know. So if you're watching this show, there is a Hep E vaccine that is being rolled out. And if you are a lady who would like to have a baby soon, it is particularly crucial that you receive this vaccination. All vaccines are great. Take all the drugs. So Dr. Nadeem, if we now sort of move towards the other kinds of hepatitis, and we're looking at the hepatitis that is basically blood-borne. So the blood-borne ones would then be hepatitis B, hepatitis C, and hepatitis D. Now, again, as a layperson, I think that Hep C has been the hepatitis which has been, I think, talked about the most and feared the most. And people seem to have caught it the most also. Now, again, this is a completely layperson perspective, so please feel free to blow this theory to smithereens. So could you tell me a little bit about hepatitis C? And when we say blood-borne hepatitis, generally speaking, what do we mean? What link, what kind of blood are we talking about? And what kind of exposure are we talking about?
Exactly. So, I would say that first of all, why they are called the blood-borne, and this is just because of their mode of transmission.
Right.
So practically, these viruses, so if we are talking about hepatitis B virus, hepatitis C, and the Delta, the D virus, they are present in the blood and all the other body fluids, like in saliva, in the semen, in the vaginal fluid, and so they are present in all the body fluid basically.
Okay.
So why they are called the blood-borne? Because mostly they were spread by if our blood is getting in contact with infected blood. How it would happen? For example, somebody get the blood transfusion and that blood was not tested for hepatitis B or C or HIV also. So we can directly get, because we have directly received a blood into our blood which was infected. But similarly, same thing can happen, as we said before, that we only need a minute quantity of this virus to get infected. So if somebody has used a syringe, and that syringe was used in a patient with hepatitis C or hepatitis B or even HIV, and the same syringe is used again by somebody else. This is very common if somebody is, if you know about the drug addicts, they share the syringes.
Absolutely.
Heroin addicts. So they share the syringes, and they can easily pass the disease from one person to the other person. But again, in our rural areas where there was a problem with the syringes, even the syringes were used between the patient as well. If somebody can get in contact with the contaminated syringe, we can easily get this blood. And also there would be, if same thing can happen if, sharing razors or blades, if any contact with the blood can easily transmit this virus. That's the reason they are called the blood-borne. And
so if we're because you mentioned blades, and that is something that I also had down, and I was also thinking about salon implements and people, barbers that use razors to shave. So if you sterilize, or even medical equipment, if you sterilize all of this equipment properly, then it is possible to then kill all the germs and for it to be perfectly safe?
That's true, exactly.
Okay.
So I think the biggest source of the spread of the hepatitis C in third world country, and particularly in Pakistan, is the iatrogenic, which means that it is spread by the medical personnel. How can that happen? As we said, that there are a lot of centers which were receiving blood, even up to last decade, they were not tested. And, they were not properly screened for hepatitis C and hepatitis B and HIV and all those. So, that can easily transmit the blood. Secondly, if we are, if somebody's undergone a surgery and the instruments are contaminated, they are not properly sterilized. If they are used in a patient with hepatitis C and a subsequent patient comes and the same instrument are used without being properly sterilized, we can easily transmit this infection from one person to the other person. And similarly, if somebody's having dental work, most of the people think that the dental work is safe, But this was the largest source of spread of hepatitis in the third world countries because it can
Really?
easily transmit virus from one person to the other. So the dental work is a major huge issue, which is the reason why we are getting such a huge burden of hepatitis in third world country. And it is not getting better; it is getting worse. And
because it's so easy, and there's so many ways people can get infected. And like you said, Dr. Nadeem, it only takes just a little bit of virus to infect the other person. So, Dr. Shahzad, why is hepatitis C so scary?
So, as Nadeem, eloquently explained hepatitis C, that the problem with these particular type of viruses is that they can cause chronic disease. So once a person gets this virus, up to 20% of the people can clear it. 15 to 20% of the people will have the virus, their body will react with it and will get rid of it. But in up to 80% of the people, the virus will stay there, and over decades, it will cause damage. Now, the issue is that people only try to treat symptoms, and this virus does not cause symptoms for 10 to 20 years until the liver is damaged enough. It can potentially remain silent in the body, not cause any symptoms whatsoever, keep on eating up in the liver until the liver is damaged significantly or has developed a tumor or something that can produce symptoms.
And then that's when you begin to feel ill. But after potentially 10 years of just sort of incubating Hep C, and during that time, are you also shedding the virus?
Well, hepatitis C can spread by if blood is taken from the patient and is injected to other people. The risk of sexual transmission with hepatitis C is relatively low. So the chances of, for example, the wife getting it from the husband is very, very low. However, if that particular person shares a needle or a razor or he gives blood to somebody else, then the virus can spread.
Yeah. Is it possible for if one has Hep C, gets pregnant, can you pass it to your baby?
Yes, up to 6% of the people can potentially pass it to their child as well.
Wow. And then if C, is it treatable? Can you cure it completely?
Yeah, so that's where the good news comes. Previously, Hep C has always been sort of since its discovery in 1989, people have worked towards finding treatments for it. And initially, interferons were used. These were injections that were given. These had many side effects, and the clearance rate was, not as brilliant. But over the recent years, some medications have been developed who have an excellent profile in clearing the virus. The clearance rate is above 97% in some cases, and the side effects are very low as well. So it has become, from being a very serious, condition to have to relatively inconsequential nowadays.
But provided that's diagnosed at a point where your liver is still more or less intact, I imagine. I'm going to take a very quick break at this juncture. I come back to more liver talk in just 1 minute. Stay with us. Welcome back to the coffee table, where we have been having a fascinating conversation about the different kinds of hepatitis, what happens if you get them, and what is the prognosis. And so far, it seems like hepatitis is a nasty disease to have, but it's treatable. Need to be diagnosed in time. Ideally, never catch it, but lots of people get it all over the world. We're in conversation with Dr. Nadeem Iqbal, who is a consultant gastroenterologist at Shifa International Hospital, and Dr. Shahzad Riyaz, who is a consultant gastroenterologist, hepatologist, and interventional endoscopist. So before the break, Dr. Nadeem, we were talking about Hep C and how there is an effective treatment available for it, but a lot of times, again, also with Hep A, you can just kind of be silently carrying it around and not even know you have it until you potentially get very, very ill. But what I'm curious about is hepatitis C in children. So, children's exposure might be different, and I know that, for example, thalassaemic kids are probably at a higher risk for Hep C, but then how does Hep C present in children?
Okay, so again, hepatitis C, as Dr. Shahzad Riyaz has said, that the patient can have hepatitis C and even hepatitis B up to 10
or
to
B,
15
yes.
years, and they might not have any symptom at all, and they will only seek the medical attentions once there has been extensive damage to the liver, and only then we know about it. This is a huge problem. And in children, the hepatitis C is not as common as compared to the hepatitis B.
Okay.
And the reason is that hepatitis B is very, very transmissible. And
how is that?
In case of hepatitis, so in case of hepatitis C, the chances are very less that it will be transmitted from mother to the baby. The chances are like 1 to 2%. But in case of hepatitis B, it can be, the chances are very high, up to 80% chances that it will be transmitted through via placenta to the baby. So that's the reason we have more children, if they are born to the hepatitis B positive mother, that they are having the hepatitis B positive. But hepatitis C can still happen in the children, and that is usually, it happens in the setting of, for example, if the kids are having dialysis, and they are getting or if they have the thalassemia, that they are getting the repeated blood transfusion, or again, it can happen via the medical personnel in terms of some injection or some instrument. But most of the children, by and large, the children mostly have hepatitis B rather than C.
So Dr. Nadeem, tell me, how does hepatitis B present itself in children, and does it manifest differently in children as compared to adults, or is it more or less the same?
Okay, so the children having the hepatitis B, as we said, most of the time they acquire hepatitis B because they are born to hepatitis B positive mother.
Right.
So and most of the time hepatitis B is acquired during our childhood, and the transmission is, as we said, is transplacental. That during the last trimester of the pregnancy, the virus is transmitted to the baby. If we knew about it, it can be prevented. The good news about that is that can be prevented. And how would that? We can come back to later on that how we can take the several measures to prevent it.
Yes.
But if coming back to your question that how it will be the symptom wise, and again hepatitis B can when it affects the children, it can sometimes have acute illness, which means that patient can be, or the children can be very sick. So, and they can develop the full-fledged hepatitis, and that includes, that can be, lethal as well, and that will include everything. They will have fever, they can have, even the yellow discoloration of the eye, the jaundice, and then if you do the blood test, they will be deranged, and it can affect the liver, and it can even result in what we call an acute liver failure. And that can be lethal as well.
Yes.
It can happen like that. But most of the time, most of the children have a minor disease. They just have a flu-like symptoms, and then our own body control it, and then this virus can remain silent for years.
Yes.
And
so like Hep A, if the body can deal with Hep B by itself, then do you also kind of just automatically recover as well? Does it take that same trajectory?
No. With regard to the hepatitis A, our body completely cures it, and we develop immunity against it. But this is in contrast to the hepatitis B. Having said that, as we said, so most of the time when we acquire the hepatitis B infection, most of these infections are actually resolved by our own body.
Right.
But once we acquire the hepatitis B virus, this will never go away. It will always persist.
Right.
And even despite with our modern treatment, we are not able to clear it from our system.
Really?
We can clear it from the blood. Yeah, we can clear it from our blood because this hepatitis B is actually incorporated into our DNA, and it will stay there forever.
Good Lord!
Once you get infected with hepatitis B, unfortunately, it will stay there forever, and it can reactivate at any stage.
Good gosh, that really is this sort of very terrifying kind of hepatitis to have. So, Dr. Shahzad, does that mean that if one contracts hepatitis B, then you basically have to manage it for the rest of your life?
So hepatitis B is a very interesting virus. As Dr. Nadeem said rightly, that once it enters the body, it stays there. But unlike other viruses, it doesn't always cause damage in everybody. The two main ways the virus enters the body, in 90% of the cases, it's with what we call vertical transmission.
Right.
That basically means that the virus is contracted from the mother. The baby gets it from the mother. Okay. And once they get it at that stage, they usually develop chronic hepatitis B in over 90% of the cases, which means that their body has the active form of the virus. Yeah. The other way of contracting hepatitis B is in adulthood, and that's due to sexual transmission. But at that time, during adulthood, your immune system is quite developed, and the body tries to fight off the virus and suppress it. And in majority of the cases, it does manage to suppress it to a point where it does not cause damage to the liver. So the important thing with hepatitis B to remember is that it is a virus that once it enters the body, it doesn't go away. However, not in all cases does it cause damage. It can sometimes just remain dormant in the body and not cause any issues.
But it seems like almost all of these various kinds of hepatitises, keep saying hepatitises, what is the correct, is there a medical term for plural hepatitis? They're all preventable. And so in that case, Dr. Nadeem, what do you think are methods or ideas that one could have to try and curtail the spread of various kinds of hepatitis? Now, as a layperson, for me, I think that vaccination seems to be one kind of obvious thing to do.
I think we can discuss, one by one, because this is very important, and that's the reason for this program is that we actually want to create an awareness. Yeah. And this is the whole purpose of this program is to create the awareness. Indeed. Yes, so I think this is a very important aspect, the prevention. They are preventable, and we'll first of all we talk about the hepatitis B, and I think we can talk about hepatitis B and C together because they're the blood-borne.
Blood-bornes together.
Blood-borne together. So the first thing is that if somebody is in need of getting the blood transfusion, it is almost mandatory. It is absolutely essential that the blood is screened for hepatitis B and C. Do not get any blood, without screening. Okay, this is the most important thing. So all the blood products. This is the regulation as well by government of Pakistan internationally as well, that no blood will, nobody will get the blood which is not screened. So this is the most important thing. Other thing. Always, so first of all, try to, limit the use of syringes, even in the hospital.
And we do, this is a problem, is it? Because I think that our sort of medical culture is also one, especially in maybe lower income clinics and different, smaller setups, where, you get an injection for everything.
So try to limit the use of the injection. This is the important thing. And try to treat the patient with the oral medication as long as this is possible. And again, if there is a dire need of using the injection, there should be, guaranteed that, this syringe is not contaminated and everybody is using,
a fresh syringe
needle.
Every time.
Fresh syringe, and it is used only for disposable and once-off use, and then it is discarded properly. Because there had been programs that these syringes are, you discard them and the people can pick them up and they can be reused.
Yes.
This is the dangerous thing that even not only the syringes. I have seen a program in the television that the people are even reusing, the tubing used for the blood transfusion, they are even reused, and this is the dangerous part of the society as well. Okay, so yes, so the limit the use of syringes and always use the disposable syringes. Then the patient ask whenever they go for some dental work to ensure that all the equipments are properly sterilized.
Yes.
Okay, and obviously there is when they go to the barber shop, the razor should be again disposable and once off use, and it's new and clean. And there was no sharing of even the toothpaste, the toothbrushes. There should be no sharing of toothbrushes.
Okay.
Even blood can come from our gum and can contaminate the others. So this thing is also important.
Yeah.
And this is the one thing. And I think the government has the responsibility that they should make this, the people will also, they'll take their precaution. But at the same time, we do need a legislation from the government to ensure that, all the bloods are screened. Even the smaller hospital, there's so many, there's a network of hospitals.
Absolutely. And lay people can't sort of go around telling medical professionals what to do. One can only ask, but there's no way of checking. And you're absolutely right that we need stricter legislations and rules and fines in place to make sure that people don't, that people take it seriously. Well, thank you so much, Dr. Nadeem and Dr. Shahzad, for joining me today on the show. I think it's been so informative. I've learned so much. One thing I feel that is important is that there are many, many ways in which you can contract forms of hepatitis. I feel like this shouldn't be a precursor or preclude your access to healthcare, and that it shouldn't be stigmatized. That, oh, well, Hep C, Hep B only happens a certain way. It's blood-borne. You can get there many, many ways that you can get it. It is really, really easy. Like these doctors have been telling us that it only takes a tiny amount of exposure to contract hepatitis. However, it is all treatable. It is all preventable. There are vaccines available. Get your vaccines. Be sensible and look after each other. Thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye. Don't share toothbrushes.